Now that you understand the basics of the anatomy and some of the function of the shoulder, let's look at some of the basic injury patterns that can occur to the rotator cuff. The very first problem of the socket, and the most common, is that because the socket is mobile, because it's made of the rotator cuff, it's reinforced by a hard roof, which is made of a bone and a very important ligament. And as the rotator cuff moves in and out of this particular socket, contact with the roof is normal, but contact can become abnormal. And when this happens, the socket will get inflamed. Specifically, the bursa, which is supposed to pad this contact, will become inflamed. And so very early in a shoulder problem, the treatment is directed at healing the inflammation of the bursa, which is sometimes referred to as bursitis, but specifically in the shoulder, we often refer to this as impingement. And here you'll see that the bursa is normally padding the shoulder when there is normal contact, and then you'll see that the bursa becomes inflamed with abnormal contact. And that's probably the most important thing to understand about the first part of a shoulder problem, is that inflammation is a big problem and causes a lot of pain for patients. Inflammation is probably the most important thing to understand, and healing inflammation, which we're about to talk about, is equally important. But wear and tear of the rotator cuff is an eventuality for a shoulder that is having abnormal contact and stays inflamed. And the reason that that's important to understand is that if we don't treat the inflammation, if we don't stop the wear and tear, the shoulder will eventually have the tendon get injured. And by this I mean that the tendon will start to tear away from bone. And when that happens, the symptoms that patients present with are often weakness, difficulty moving their arm, and difficulty sleeping. So with that in mind, let's talk about how we treat inflammation. The body, when it has inflammation, is actually part of a normal healing response. The body's trying to heal an injury to that area. Unfortunately, in this day and age, inflammation is an extremely common problem. So common that we often take it for granted. It is by itself not an abnormality. However, when it continues beyond the initial healing response, it can cause significant pain and shoulder dysfunction. And so the very first thing that I look at when I examine a patient and talk to them about their history is, have they treated their inflammation? And the most important way to treat the inflammation is to take an oral medication that is very, very common and often misunderstood. Ibuprofen or Motrin, or any of this class of drugs, which is called the non-steroidal anti-inflammatories, can be very effective at getting rid of low-level inflammations. And of course, you cannot take these medications if you have stomach problems, and we discussed this in the exam room. The other important way to take care of inflammation is to ice the shoulder. Ice is probably the most powerful anti-inflammatory, and yet it is commonly used but not commonly understood. And so for patients who have relatively new inflammation or have inflammation that has not been treated, I recommend these two treatments to start with. Now, once we've treated you with the oral medications and the ice, if your shoulder problem has resolved, no further treatment is required. However, for a lot of patients, the inflammation may require more powerful treatment, and that treatment comes in two forms. First, physical therapy. Physical therapy is a way of retraining the shoulder and also to treat the inflammation through ultrasound and ice and other modalities that they use. And one of the most powerful treatments that I can do for any patient is to inject a steroidal anti-inflammatory, often commonly known as cortisone, but in my practice I use Kenalog. Although no one really wants an injection, I will tell you that the injection is extremely powerful treatment. For many patients, it's all they need, and it avoids the need for surgery. And we'll be talking about surgical treatments in our next segment.